Introducing hypnosis. We all have a picture of hypnotism in our heads, a result of popular culture messages over the years. A man, cloaked and looking somewhat sinister, stands over the fearful subject. He waves a gold pocket watch in front of him and quietly drones, "You are getting sleepy, very sleepy." Soon the subject slumps in his chair, and he seems to take on a zombie-like state in which he is compelled to obey the hypnotist. Whether he's asked to quack like a duck or begin gyrating like Elvis Presley, he is now merely a puppet of the hypnotist. When he is awakened, often with the snap of a finger, he will remember nothing about his actions, and those who have watched all this have been treated to a great show. It is true that hypnotism has a long history of being used for entertainment, but it has an equally long history of being used in a therapeutic way, treating everything from chronic pain to addictions. It is this facet of hypnotism that we will be examining. Group hypnotism has been practiced since ancient times. In ancient Greece and Egypt, religious centers were set up to treat troubled citizens. Through hypnosis, they were induced to dream, and those dreams were then analyzed to provide relief to the patient. Other cultures have also turned to alternative states, such as trances, to alleviate problems using both drugs and psychological techniques as a gate to the unconscious. But the first real father of hypnosis was Franz Mesmer, 1734 to 1815, an Austrian physician in the mid-18th century. Mesmer believed that a universal fluid was present in everything, including the air we breathe, and this fluid was absorbed by the nerves of the body. He identified it as animal magnetism. He believed disease was a result of a blockage in the circulation of this fluid, and that laying hands on the body could unblock this fluid. A showman, he would sometimes sweep his arms over a subject for hours on end, putting him in a trance, some suggest, brought on by intense boredom. James Braid, a Scottish surgeon, 1795 to 1860, noted that a subject could go into the same sleep state if he fixated his eyes on a bright object. He hypothesized that staring at something could exhaust the nervous system, making it possible for the subject to be far more open to suggestion. This treatment was useful for conditions where no organic origin could be identified, and he referred to the treatment as hypnosis, from the Greek word hypnos, meaning sleep. Sigmund Freud, in the late 19th century, hypothesized that neurosis was caused by repressed traumatic events, and tried to use hypnosis to bring these events to consciousness. He was not very successful and became convinced that hypnosis did not, in fact, work. Hypnosis went into disfavor until the early 20th century, when a scientist named Coué began once again to investigate its claims. Émile Coué, in the early 20th century, believed in self-healing and described a positive attitude as the most important aspect of all healing. He introduced his now famous affirmation, "Every day I am getting better and better," and spoke of the imagination being more powerful than the will. For example, if you were to walk a plank on the ground with your eyes closed, and then compare it with walking on the plank while imagining it is 10 feet above the ground, the results would be considerably different. It would be far harder to walk the plank when your imagination has created a more difficult task. This same phenomenon could be used to make positive changes in one's life as one imagined or visualized the wish for success. Hypnosis could facilitate this kind of self-healing. By wartime in the 20th century, hypnosis was being used to reduce stress in soldiers suffering from post-traumatic injuries. Milton Erickson used hypnosis in psychotherapy, using words alone to induce a hypnotic trance. He believed that people hypnotize themselves on a daily basis when they become highly focused on some thought or object in their environment. By the mid-20th century, the British Medical Association and the American Medical Association had identified the therapeutic use of hypnosis as a form of relaxation that could be used for such conditions as addictions, stress, pain relief, and weight loss. As the century progressed, there was increasing concern for the possibility of false memory syndrome, a condition possible, it was believed, because of the high level of suggestibility a patient experiences while under hypnosis. Hypnosis also became more common in dentistry, childbirth, and surgery as a natural form of anesthetic. Chapter 1. What is hypnosis? So what exactly is hypnosis? The jury is still out on this one, and you can find as many answers as the experts you ask. But certain fundamental characteristics are identified by all. Hypnosis involves the following: intense concentration, extreme relaxation, and high suggestibility. Hypnotism usually involves both a hypnotist and a subject, although it is possible for someone to hypnotize himself. It involves a trance-like state in which a person becomes highly focused and is much more open to suggestion. At all times, the subject remains aware of the presence of the hypnotist. Some experts describe it as an alternative state of consciousness. Attention is focused away from the present reality and toward particular images, thoughts, perceptions, feelings, motivations, sensations, and behaviors of another time. When someone is hypnotized, she may be more able to access her own creativity, limit the effect of inhibitions, and work to reprogram patterns of thinking and behaviors. She can be especially receptive to suggestions to help heal herself. Critical judgment may be weakened, and response to suggestions or commands strengthened. This state resembles sleep, but is induced by suggestion, and calling it sleep or hypnosis is inaccurate. Rather than being in a drowsy state of sleep, the subject is actually hyper-attentive, focused on the words of the hypnotist. To understand this, think about how you feel when you are daydreaming or find yourself lost in a book or a movie. You're fully conscious, but can tune out most of the stimuli around you, focusing only on the story, for example. And the imaginary events you are thinking about, reading, or watching can cause you to experience real fear, sadness, or happiness. By focusing intently on the subject at hand, you exclude other thoughts and other sensations. This is very similar to what someone experiences when he is hypnotized, and in fact, some would argue, this is a kind of self-hypnosis. Chapter 2. How does hypnosis work? By using intentional relaxation and focusing exercises, an individual can attain a mental state similar to that state between wakefulness and sleep. Many believe this is a way to access a person's subconscious, free of inhibitions and critical thinking. That subconscious is always active, but is overruled by the conscious mind. Often, what we identify as sudden insight is really the effect of the constant work by the subconscious to put together plans and ideas. When we dream, the subconscious is freed to come to the forefront where the conscious mind does not filter its messages. The subconscious can also regulate bodily sensations and trigger feelings. It contains memories of past events that we have consciously forgotten. All of this is available to us through hypnosis. There are definite physiological changes in someone undergoing hypnosis, but it is questionable whether these are due to the hypnosis itself or the state of complete relaxation the subject is in. Heart rate and respiration may slow down, often a sign of increasing relaxation. Electroencephalograph or EEG readings show that different brain waves occur during hypnosis. During fully conscious awareness, we see beta waves of 14 to 35 Hz. This state is described as an attentive mind which uses logic to reason, evaluate, assess, judge, and make decisions. The hypnotic state shows a marked increase in alpha waves, 8 to 13 Hz. Similar to brainwaves of someone meditating, this state has been described as opening a doorway between the conscious and subconscious, where memories are easily accessible and new information can be stored. It is not thinking in the traditional state, but instead experiencing without questions, critical judgment, or analysis. This state is different than the dream state with its theta waves, or sleep with delta waves. Some studies have shown that different parts of the cortex, the upper part of the brain, are activated during hypnosis. The left side of the brain, considered the more analytical area, the logical control center which uses deduction, reasoning, and convention, has less activity, while the right side becomes more active. Although there is mental activity distributed throughout the brain, the right side is usually more associated with increased imagination and creativity. It is hypothesized that during hypnosis, this area can be accessed and deep-seated instincts and beliefs can be reprogrammed. Although suggestions must be acceptable to the subject, a lowered critical faculty allows new information to be absorbed. Skeptics often argue that although people can be seen to enter a special state where they are abnormally suggestible and uninhibited, they are not really in such a state, but just think they are. This is a result of social pressure and expectations, and the influence of the hypnotist to convince them that they should act in a certain way. Much like a placebo effect, they are hypnotized because they think they are. But proponents of hypnosis argue that if someone can be convinced to have a change in consciousness, then that is a fact registered within the mind, and consequently results in a kind of hypnosis. So social pressure and expectations only add to the effectiveness of the hypnotic state. There is some dispute as to whether hypnosis can actually enhance the accuracy of memory. Because those who undergo hypnosis most easily are people with a high degree of imagination, they may easily fill in memory holes under suggestion. Confabulation is quite common under hypnosis, and in fact, many states do not allow testimony induced by hypnosis because it is considered very unreliable. Finally, hypnosis has been described as a learned social behavior. A subject and a hypnotist both learn what is expected of their roles and reinforce each other by their performances. Performing an act of social conformity rather than experiencing a unique state of consciousness, the subject will act in accordance with the expectations of both the hypnotist and the situation. As far as changes in EEG readings, such changes can occur with any change in thought, particularly if one becomes more relaxed during the process. One critic described those changes as no different than daydreaming, concentrating, or imagining the color red. Each process shows electrical changes in the brain that differ from ordinary waking consciousness. Chapter 3. How do we get hypnotized? There is some discussion as to whether an external hypnotist is necessary. Perhaps it is suggested the subject is always the one who initiates the trance, and it is the hypnotist who serves merely as a guide to facilitate the process. We know certain things must be in place for someone to be effectively hypnotized. The subject must want to be hypnotized, believe he can be hypnotized, and be willing to feel comfortable and relaxed. One of the most familiar forms of hypnotism is the fixed gaze induction, where a subject is asked to fix his eyes on an object moving in front of him. However, this form does not work with most of the population and is rarely used anymore outside of entertainment shows. The subject is asked to focus on the object so intently that he tunes out all other stimuli, and the hypnotist will talk to the individual in a low and relaxing tone. Another form of hypnotism is to overload the mind with sudden, firm commands. If these commands are forceful enough, and the hypnotist manages to maintain a strong sense of charisma or authority, the subject may surrender conscious control of the situation and be willing to follow the instructions of the hypnotist. When hypnotists work in an entertainment venue, the very circumstance of being on stage in front of an audience may put the subject on edge and make him more susceptible to the hypnotist's commands. The most common form of hypnosis uses progressive relaxation exercises to systematically relax and focus a subject, while the hypnotist speaks in a slow and soothing voice. Self-hypnosis training, relaxation, and meditation tapes all use this method. Chapter 4. Myths about hypnosis. We may all think we know a lot about hypnosis because displays of it have been part of popular culture most of our lives. But that familiarity has bred many myths. This is an opportunity to dispel them. Myth number 1. When you are hypnotized, you are asleep. In fact, you are awake at all times. If anything, you're hyper-alert, focused completely on specific images, thoughts, and ideas. Myth number 2. When you are hypnotized, you can be forced to do something against your will. No one can make you do anything you don't want to do. Although your critical judgment may be weakened, changes in thought and behavior must be acceptable to the subject on a moral and ethical level, as well as considered safe. At all times, you remain in control. Even when you become involved in a stage show on hypnosis, your participation is a voluntary process. You have already given permission to the hypnotist to engage in this act. Myth number 3. Hypnosis is unnatural and an altered state of being. Hypnosis is a completely natural state of concentration and relaxation, used for centuries. It is a state of mind in which, mentally and physically relaxed, we can facilitate communication with our subconscious and conscious mind. Myth number 4. Some people just can't be hypnotized. If someone wants to be hypnotized, he can be. All he needs to do is follow simple instructions on how to relax. However, alcohol or drugs can interfere with obtaining a hypnotic state. Myth number 5. You don't remember anything that happened while you were hypnotized. There is no confirmed amnesia after hypnosis. A subject will remember everything that took place during the session. Myth number 6. There is an official hypnotherapy regulatory body. There is neither one governing body nor single official certification process for hypnotherapists. In fact, some individuals call themselves hypnotherapists after a 2-day course. However, the National Guild of Hypnotists, the American Psychiatric Association, and the American Medical Association have strict standards for the professional practice of hypnotherapy. Myth number 7. You cannot talk while you are hypnotized. Not only can you speak during hypnosis, but in analysis you will be encouraged to do so. Myth number 8. You can get stuck in a hypnotic state. There is no evidence that this can occur, and if you are not appropriately brought out of the state by a hypnotist, you will slowly regain normal consciousness within a few minutes on your own. Myth number 9. Hypnosis is a short-term and quick solution to many problems. Although such simple problems as smoking, nail-biting, and stress can be somewhat alleviated in a single session, most problems are better dealt with in several sessions, perhaps 6 to 8, over a period of time, to address underlying issues supporting these symptoms. Myth number 10. The deeper the trance, the more effective hypnotherapy will be. There is no evidence that the depth of the trance is correlated to the beneficial results of the hypnosis. Chapter 5. Finding the right hypnotherapist. It is important to recognize that hypnotherapy is a two-way process between the therapist and client. The most important consideration is to assure that you trust your therapist. Make sure he is an experienced practitioner in full-time practice for at least 2 years, and avoid quick-fix solutions. Be aware that this process will take time for each session and for the treatment as a whole. Arrange for a consultation with the therapist to discuss the issues of concern. This is also an opportunity to discuss hypnosis in detail, what it involves, how you might feel during the session, and what results you can expect from the treatment. Pay special attention to the tone of the hypnotist's voice. A grating voice or one that you're not comfortable with is not likely to encourage relaxation during a session. Make sure that you feel comfortable and at ease with the therapist. Assure yourself that you will be able to terminate a session any time you wish to do so. Also, make sure that you will have time at the end of each session to ask questions and discuss the experience with your therapist. Although group hypnosis can work on specific bad habits, the results tend not to be as effective. A one-on-one session is usually far more effective, where the session can be tailored to a particular individual. To find a good hypnotherapist, ask your doctor or health provider. Ask for a free consultation to get a sense of the therapist and his education and training. This should include what was covered in his training, with whom he trained, and how much experience he has. The American Board of Hypnotherapy at 1-800-872-9996 can provide a list of trained therapists in your region. Chapter 6. What does a hypnotherapy session look like? During the first session, the therapist will ascertain your ability to be hypnotized. This ability will be affected by your willingness and belief in the process. Some exercises to determine this include imagining your hand is so heavy you cannot lift it. Those who strongly respond to this suggestion are good candidates for hypnosis. Another test sometimes used is the eye roll test. You'll be asked to roll your eyeballs upwards and then close your eyelids over them without moving your eyeballs down. Another test involves staring at a small light in a dark room. Those who can complete the eye roll test or see the light changing direction when it is suggested are considered suitable candidates. Once your suitability has been ascertained, you will be asked to identify the behaviors you want to change during these sessions. The development and effect of these habits may also be discussed. The therapist will want to make sure you really wish to change these behaviors. To induce a trance-like state, the therapist may swing an object back and forth in front of you or ask you to count slowly backwards. You may then be asked to imagine yourself in peaceful surroundings, a place you can feel comfortable and safe in, such as a beach or in the woods. Once you're completely relaxed, the hypnotist may begin to make suggestions to change negative behavior. He may do this by pairing the behavior with negative events. For example, he may tell you that each time you want a cigarette, you'll feel ill. You may be asked to imagine yourself as a non-smoker. For someone trying to lose weight, suggestions may be made such as, each time you see fatty food, you will feel nauseous. Or you may be asked to imagine yourself at a lower weight, relaxed and in control. A session will usually last for 1 hour. At its conclusion, the therapist will give you an opportunity to ask questions and discuss the experience. Further discussion may concern future sessions or learning self-hypnosis. The number of sessions will depend on the problem and how easily the behavior can be changed. Chapter 7. Uses of hypnosis. Hypnosis can be found in a variety of settings, such as a bar or nightclub, clinic, classroom, dentist, or police station. In a bar or club, it is considered strictly entertainment, with alcohol as the social bonding agent, and group expectations will have a great deal to do with the experience. Medical hypnotherapy relies on the integration of mind and body. When the subconscious is convinced of something, it can bring about changes in the entire body to substantiate that belief. For example, if it's suggested that the body does not feel pain while someone is in a hypnotic state, it is possible to have anesthetic-free childbirth, alleviation of the pain of chemotherapy, and drug-free surgery. By accessing the innate healing capacity of our own bodies through the stimulation of hypnotherapy, many issues can be addressed, such as stress, anxiety, panic, phobias, unwanted habits and addictions such as smoking, overeating, and alcoholism, disrupted sleep patterns, low self-esteem, fear of examinations, fear of public speaking, migraine, irritable bowel syndrome, anger management, and sporting and artistic performance enhancement. Positive results have not been found in subjects with depressive illness, epilepsy, or psychosis. Psychiatric hypnotherapy focuses on deep personal problems. It can be used to break negative patterns of behavior and is especially effective for phobias, unreasonable fears of objects or situations. There is some evidence that hypnotherapy can bring underlying problems or traumas to a conscious level. Fears, memories, and repressed emotions can be brought to the surface and then dealt with in an analytical and logical manner. Law enforcement, or forensic hypnotism, helps subjects to access deep memories of past crimes and their details. This use of hypnotism is highly controversial, and there is a concern that false memories may be created during the process. For this reason, many states do not recognize testimony obtained during hypnosis as reliable. Chapter 8, Creating False Memories with Hypnosis. There is increasing concern about the creation of false memories while undergoing hypnosis. A new study suggests that hypnosis doesn't help people recall events more accurately, but it does tend to make people more confident of their inaccurate memories. When students were hypnotized and asked to give dates of specific news events over 11 years, they were no more accurate than non-hypnotized students in choosing the right dates. However, they were more reluctant to change their answers when told they might be wrong. They had faith that hypnosis helped them to accurately recover lost memories. When people are in a highly suggestible state, they are often told to imagine a situation. Imagining can lead to a sense that such an event really occurred. If this information is corroborated by another, such as an unethical hypnotist, it becomes even more difficult to question its reality. False memories are constructed by combining actual memories with the content of suggestions received from others. During this process, individuals may forget the source of the information. In this way, false memories can be created in a person totally convinced of their truth. Chapter 9, Treating Weight Problems and Other Addictions. By going beyond traditional talk therapy and examining the emotional reasons behind the problem behavior, hypnosis can sometimes be more effective in curbing addictive behavior. However, it takes a highly motivated individual to tackle these addictions. Clinical hypnosis can help increase the motivation to change. It may encourage an individual to imagine the reality of existing beyond these addictions. It can help the addict to contact strengths within herself. It can enhance learning. Because of the unique nature of each individual, by collaborating with him, a therapist can serve as a facilitator for self-healing. By identifying the emotional core of the problem, a patient can begin to understand the root of these addictive behaviors. By changing the script that led to this adaptation, he can begin to take control of unhealthy habits and replace them with different and healthier choices. There are many advertisements for quick-fix solutions concerning addictive behaviors. Just listen to this audio tape or attend that seminar, and you will lose 70 pounds, stop smoking and drinking, and instantaneously relearn adaptive approaches to life. The truth, though, is that hypnotism is only one part of an integrated program of weight loss or changes in any addictive behavior. Without psychotherapy and behavioral training, results arising from hypnotism are not likely to be maintained. The patient needs to understand why the addiction arose in the first place, and the answer to that question must be addressed. Moving away from addictions involves a change in lifestyle. For example, a successful weight loss program will include daily exercise, a diet low in fats and sugars, increased water consumption, and visualizations of a healthy body. When combined with behavioral weight management, hypnosis can serve to increase participants' attention to the suggestions of the program. It can serve to reinforce changes by emphasizing visualization and imagination. Hypnosis can support these changes in several ways, including suggestion. You no longer want to overeat. You don't like to overeat. You do not enjoy eating sweets anymore. Indirect suggestion. The suggestions are absorbed by the subconscious as if they were reality. I wonder what you will look like when you are the weight you want to be. I wonder who will notice first when you have lost all the weight you want to. Double-bind thinking. Will you stop overeating today or tomorrow? It really doesn't matter because these changes are going to happen, aren't they? Visuals. You can picture yourself making good choices for a healthy breakfast, lunch, dinner, and snacks. You can see yourself going to the gym each day. Metaphor. You are planting seeds about taking care of yourself. Your unconscious mind is like a garden, and these seeds are going to take root. These techniques can be used to break through the resistance to change, which many patients deal with in trying to overcome addictive behaviors. It is important to recognize that these therapies require time to change deeply rooted behaviors. Chapter 10, Self-Hypnosis. Anyone can learn self-hypnosis. By learning how to completely relax and then making positive suggestions to yourself, you can create positive change in your life without the aid of a professional hypnotist. But there are several important points to get you started. 1. Don't try to force it to happen. Your effort will just get in the way. Instead, just let it happen. Much like falling asleep, when you relax and follow simple steps in progressive relaxation, you will be able to let the hypnotic state develop. 2. Try not to analyze everything that happens. You may not recognize when you are actually in the hypnotic state. The experience will be different for every person. Once you allow yourself to relax, you will be able to enjoy the experience. 3. Remember, self-hypnosis is a skill. Give yourself time to practice it. As you become more comfortable with the process, it will be a more powerful agent of change for you. 4. Set up a regular schedule of practice and allow yourself up to 30 minutes a day when you are least likely to be disturbed by others. 5. If you have trouble staying awake, use a suggestion to keep you from falling asleep while you practice. 6. Seat yourself or lie down in a comfortable position with as few distractions as possible. If you're bothered by external noise, mask that sound with soft music in the background or a white noise generator. 7. The 4 sections of your session will include relaxation, deepening, suggestion application, and termination. 8. Relaxation. By getting yourself physically relaxed, your mind will follow its lead. Take your time. A progressive relaxation exercise can guide you into physical relaxation. We have included an exercise at the end of this book. These exercises involve tensing each muscle group for a few seconds and then letting go. Deepening. Once you are completely relaxed, you can begin to deepen this state. Watching for this deepening will only get in your way. Much like falling asleep, your awareness that you are at the moment of falling asleep is likely to keep you awake longer. The same is true of hypnosis. One of the best ways to deepen your state of relaxation is the countdown technique. Simply start counting backward from a number of your choosing. It may be as high as 100 or as low as 20. Over time, you will know how many numbers you will need to count. Imagine you are drifting deeper with each number. When other thoughts intrude, just push them away and continue counting backward. Choose a speed which is comfortable for you. You may choose to count along with each breath. As your breathing slows down, so will your counting. Don't count out loud, just think about each number. Physically, try to keep as still as possible while remaining in a comfortable state of relaxation. 10. Suggestion application. When you have reached the end of your deepening, you can begin to apply suggestions. The physical relaxation and deepening exercises will increase your suggestibility. It helps to apply suggestions you have chosen ahead of time. They should be short and easily memorized. You can apply them at this point. You may also choose to dialogue with your subconscious. Just talk to yourself about what it is you want to do, and avoid thinking about your words in much detail. Use first person when you are talking to yourself. For example, I am less and less interested in having a smoke today, or I am enjoying myself doing many other things instead of eating a lot of extra food. The most effective kind of suggestion is using images instead of language. Imagining yourself as a non-smoker or preparing a healthy meal and avoiding overeating, as well as imagining the results of your success, can motivate you to change many behaviors. It will take time to see results from these suggestions. However, if you have not seen any results within a month, consider changing your suggestions. 11. Termination. When you have completed your suggestions, you can begin to terminate your session. It helps to formally identify the end of each session, making a clear line between the hypnotic state and your normal state of awareness. This is also effective in preventing your hypnotic state from ending in a regular nap. You do not want sleeping to be associated with your self-hypnosis. If you're practicing at night and wish to go to sleep when you're done, do so, but be sure to make a clear distinction in your mind to indicate the end of your hypnotic session. Chapter 11. Progressive Relaxation Exercise. Find a good position. Loosen any tight clothing. If your shoes feel a little tight, take them off. Allow your eyes to close. Try to clear your mind. Let the relaxation begin. Open your mouth for a moment and move your jaw easily from side to side. Now let your mouth close, keeping your teeth slightly apart. And as you do, take a deep breath and slowly let the air slip out. Take another deep breath, and as you breathe out, silently say, "Relax," and let go. Let yourself relax even further. Again, take a deep breath, and as you breathe out, silently say, "Relax," and let go. Let the air slip out easily and automatically. Now, carry on breathing normally. Study your body and the feelings you are experiencing. As you relax more and more, your breathing becomes slower. You may notice that it's slower now, and that you breathe more and more from the bottom of your lungs. Tension is beginning to leave you, and you are feeling more comfortable. This exercise is called progressive relaxation. When you tighten one part of your body, try to leave every other part limp and loose. Keep the tensed part of your body tight for a few seconds, and then relax and let go. Then take a deep breath and hold it. And as you breathe out, silently say, relax and let go. In time, this will be a technique you can use regularly to produce rapid relaxation. Your body will learn when each part of it is relaxed. By contrasting the tension you deliberately experience with the relaxation you allow to seep in after, you are teaching your body to relax. Begin your relaxation practice. First, tense every muscle in your body. Tense the muscles of your jaws, eyes, arms, hands, chest, neck, stomach, legs, and feet, and feel the tension all over your body. Hold the tension briefly, and then silently say, relax and let go as you breathe out, and let your whole body relax. Feel a wave of calm come over you as you stop tensing, and feel the relief. Then take another deep breath, and study the tension as you hold your breath. Slowly breathe out and silently say, relax and let go, and feel the deepening relaxation. Allow yourself to drift more and more with this relaxation. As you continue, you will exercise different parts of your body. Become aware of your body and its tension and relaxation. This will help you to become deeply relaxed whenever you wish to relax. Keeping the rest of your body relaxed, wrinkle up your forehead. Feel the tension. Your forehead is very tight. Briefly pause and be aware of it. Now relax and let go, and feel the tension slipping out. Smooth out your forehead and take a deep breath and hold it. And as you breathe out, silently say, relax and let go. Squint your eyes tightly as if you're in a dust storm. Keep the rest of your body relaxed. Briefly pause and feel the tension around your eyes. Now relax and let go. Take a deep breath and hold it. And silently say, relax and let go as you breathe out. Open your mouth as wide as you can. Feel the tension in your jaw and chin, and briefly hold the tension. Now let your mouth gently close, and as you do, silently say, relax and let go. Take a deep breath and hold it. And as you breathe out, silently say, relax and let go. Close your mouth and push your tongue against the roof of your mouth. Study the tension in your neck and chin and briefly hold the tension. Relax and let go. Take a deep breath and hold it. And silently say, relax and let go as you breathe out. When you breathe out, let your tongue rest comfortably in your mouth and let your lips be lightly apart. Keep the rest of your body relaxed. Clench your jaw tightly and feel the tension in your jaw muscles and briefly hold the tension. Now relax and let go and take a deep breath. Hold it. Then silently say, relax and let go as you breathe out. Think about the top of your head, your forehead, eyes, jaws, and cheeks, and make sure these muscles are relaxed. Continue to let the tension slip away, and feel relaxation replace the tension. Feel your face becoming very smooth and soft as all the tension slips away. Your eyes are relaxed, your tongue is relaxed, your jaws are loose and limp. All of your neck muscles are also very, very relaxed. All of the muscles of your face and head are relaxing more and more. Your head feels as though it could roll from side to side, and your face feels soft and smooth. Allow your face to continue to become more and more relaxed as you now move to other areas of your body. Now shrug your shoulders up and try to touch your ears with your shoulders. Feel the tension in your shoulders and neck and hold the tension. Now relax and let go, And as you do, feel your shoulders joining the relaxed parts of your body. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Notice the difference. Tension is giving way to relaxation. Shrug your right shoulder up and try to touch your right ear. Feel the tension in your right shoulder and along the right side of your neck, and hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Next, shrug your left shoulder up and try to touch your left ear and feel the tension in your left shoulder and along the left side of the neck. Hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Feel the relaxation seeping into your shoulders. As you continue, you will become loose, limp, and relaxed. Stretch your arms out and make a fist with your hands and feel the tension in your hands and forearms and hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Push your right hand down into the surface that it's resting on and feel the tension in your arm and shoulder and hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Next, push your left hand down into whatever it's resting on. Feel the tension in your arm and shoulder and hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Bend your arms toward your shoulders and double them up as you might to show off your muscles. Feel the tension and hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Move on to the relaxation of your chest by taking a deep breath that totally fills your lungs. As you hold your breath, notice the tension. Be aware of the tension around your ribs. Silently say, relax and let go as you slowly breathe out. And feel the deepening relaxation as you continue breathing easily, freely, and gently. Take in another deep breath and hold it, and again feel the contrast between tension and relaxation. As you do, tighten your chest muscles and hold the tension. Silently say, relax and let go as you slowly breathe out. Feel the relief as you breathe out and continue to breathe gently and rhythmically. Breathe as smoothly as you can. You will become more and more relaxed with each breath. Keeping your face, neck, arms, and chest as relaxed as possible, arch your back up and arch it as if you had a pillow under the middle and low parts of your back. Observe the tension along both sides of your back and briefly hold that position. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you breathe out. Let that relaxation spread deep into your shoulders, deep into your back muscles. Feel the slow relaxation developing and spreading all over. Feel it going deeper and deeper. Allow your entire body to relax. Face and head relaxed. Neck relaxed. Shoulders relaxed. Arms relaxed. Chest relaxed. Back relaxed. All these areas are relaxing more and more, becoming deeply relaxed. Now begin the relaxation of the stomach area. Tighten up this area and briefly hold the tension. Relax and let go and feel the relaxation pour into your stomach area. All the tension is being replaced by relaxation. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Now experience a different type of tension in the stomach area. Push your stomach out as far as you can and briefly hold the tension. Now relax and let go. Take a deep breath and hold it, and silently say, relax, and let go as you slowly breathe out. You are becoming more and more relaxed. Each time you breathe out, feel the gentle relaxation in your lungs and in your body. As you continue to do this exercise, your chest and stomach area will relax more and more. Check the muscles of your face, neck, shoulders, arms, chest, and stomach, and make sure they're still relaxed. If they aren't, then tense and release them again. Whatever part is still less than fully relaxed is starting to relax more and more. Soon you'll be able to tell when you have tension in any part of your body. You will learn that you can always relax and let go of the tension that you find in any part of your body. Now begin the relaxation of your hips and legs. Tighten your hips and legs by pressing down the heels of your feet into the surface that they're resting on. Tighten these muscles, keeping the rest of your body as relaxed as you can while you press your heels down, and hold the tension. Relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you breathe out. Feel the relaxation pouring in, and notice the difference between tension and relaxation. Let the relaxation become deeper and deeper, and enjoy the relaxation. Next, tighten your lower leg muscles. Feel the tension and briefly hold it. Now relax and let go. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Now curl your toes downward. Curl them down and try to touch the bottom of your feet with your toes. Hold them and feel the tension. Relax and let go, and wiggle your toes gently as you let go of the tension. Let the tension be replaced by relaxation. Take a deep breath and hold it, and silently say, relax and let go as you breathe out. Now bend your toes back the other way. Bend your toes right up toward your knees and try to touch your knees with your toes. Feel the tension and hold it. Relax and let go, and feel all the tension slip right out. Take a deep breath and hold it, and silently say, relax and let go as you slowly breathe out. Feel the tension leaving your body and the relaxation seeping in. You've progressed through all the major muscles of your body. Let them become more and more relaxed. Continue to feel yourself becoming more and more relaxed each time you breathe out. Each time you breathe out, think about a muscle and silently say, relax and let go. Your face is relaxed. Your shoulders are relaxed. Your arms are relaxed. Your hands are relaxed. Your chest is relaxed. Your back is relaxed. Your stomach is relaxed. Your hips are relaxed. Your legs are relaxed. Your feet are relaxed. Your whole body is becoming more and more relaxed with each breath. As you continue to be deeply relaxed, begin to think about your suggestions. This is the time to insert your suggestions. Then tell yourself the following: all of these suggestions will be effective because I have chosen them, and they're right for me. It's good that I achieve these goals, so I will follow them. Each time I practice this self-hypnosis, I will become better and better at it, and relax deeper and deeper. You can now begin to count from 1 to 3. As you take a deep breath, silently say each number. When you reach 3, open your eyes and you will be relaxed and alert. When you open your eyes, you will find yourself back in the place where you started your progressive relaxation and hypnosis practice. The world around you will seem slower and calmer, and you will be more relaxed and peaceful. 1. Relaxed but more alert. 2. Mentally wide awake. 3. Eyes open, alert, and refreshed. By using self-hypnosis, you can facilitate your own ability to heal yourself. You will be teaching yourself complete physical relaxation, and you will determine suggestions for changing your behavior. Conclusion. Hypnotism is not magic. It is not a gateway to another world or past lives. Instead, it enlists the power of the subject's own imagination to help her see the possibility of changing behaviors. By allowing the conscious, analytical mind to communicate with the less critical and more suggestible subconscious, a person is able to find meaningful alternatives to unsatisfactory ways of thinking, feeling, or behaving. But the subject must be motivated to make these changes. Without that motivation, hypnotism will not work to support the individual. With it, appropriate suggestions facilitated by a state of complete relaxation can lead to tremendous change. So, the image of the mysterious hypnotist leaves much to be desired. When used for entertainment, hypnotism involves frivolous suggestions and a sense of play. When used therapeutically, hypnosis becomes a powerful tool. It addresses some of the biggest questions lodged in our subconscious. What do I want my life to be like? What changes do I need to make for this to happen? Are there negative things that can happen if I make these changes? Hypnotism addresses these life questions on a deeper level of thinking, a level of which you are not always aware. Hypnotism is always in your control, whether you're working with a hypnotist or using self-hypnosis. Those who might be described as imaginative and who often think with vivid imagery are most responsive to hypnosis, but anyone can learn to enter the state of complete relaxation. Hypnosis involves a hyper-awareness that allows the subject to block out extraneous stimuli and thoughts. Because critical thinking is inhibited in the brain, he is subject to suggestions at a much greater level, although these suggestions must still be ethically and morally acceptable to him. Whether used in law enforcement, medical or psychological hypnotherapy, hypnosis can be an effective tool when used in a professional and supportive manner. If you're interested in pursuing this kind of treatment, it is important to examine the issue from all sides. 1. The professional and educational experience of the hypnotherapist, including all relevant training. 2. Your own level of comfort and safety working with this therapist. And 3. Your personal level of motivation to change behaviors. If you're dealing with a medical or psychological problem, first consult a qualified healthcare provider for a diagnosis. That individual will be able to help you decide whether hypnosis is indicated and how it might be incorporated into your treatment. So, enjoy the entertainment show in Las Vegas or traveling hypnosis shows. Enjoy the hypnotist with his black cloak and gold pocket watch, and enjoy the magic. But remember that hypnosis is really, in the final analysis, about relaxation and about the ability of our minds and bodies to heal themselves. Hypnosis facilitates a normal and healthy process, and that is the best magic of them all.